This tutorial is on iPad navigation, ocular exam room workflow. This tutorial will show you the proper steps to document in the ocular exam room. The workflow in the ocular exam room would be first to perform an exam, select your exam set, document the CD ratios, and select Done. Next, we want to document our diagnosis. So here we'll select blepharitis. Our ICD-10 expert is highlighted, so we want to make sure that we do pick a selection other than unspecified. We're going to then select our findings, which describe our diagnosis. So we'll say maybe abnormal tear breakup and collarettes. Then we want to select our classification. Let's say that we have documented this diagnosis for the patient before, so we're going to select status and we'll say it's stable. Next, it's extremely important that we touch the location on the diagram to document the appropriate location for ICD-10 coding. Is it in the left eye, the right eye, or is it both? So I'm going to select both eyes. It does not matter where I touch. It's just simply going to document right and left. So the steps again are exam, select your diagnosis, document the ICD-10 if necessary, document any findings, document your classification, and select your location. Next is the plan. The plans list is populated with a list of plans that only pertain to blepharitis. So here I have a popular plan list because I've used this diagnosis before and my system has remembered the plans that I use. So what did you do with the patient? Every single diagnosis has a plan called counseling. Counseling is not required, however, it will educate your patient about what you discussed with them. So I'm going to choose counseling blepharitis. If you talk to your patient regarding the diagnosis, make sure you're picking the counseling plan. The counseling plan is where you can document quality measures if it's relevant to the diagnosis. If you plan on using the patient portal, counseling will provide education to your patient through their portal, and this education can also be printed and handed to the patient from your practice. The counseling blocks can be customized per provider. And these are preloaded verbiage that was written by doctors. However, you'll notice that each of them has a little green S, which is a sticky field. You can add or change the counseling statements, and these items will remain sticky for each logged in user. The system adapts to what you document under your logged in user. The next time you choose this diagnosis in counseling, it'll remember what you've put here, and each doctor will be able to customize their own counseling statements. The check marks are just simply stating that this is what we want to include in our education. If you don't want to include, for example, contact office, then if you uncheck that, please remember that that's going to become a sticky field, and the next time you use this counseling, that box will not be checked. If you have specific counseling for this one patient, you can use the patient-specific counseling to type that information in. This is not going to remain sticky. It'll only document for this one visit. At the top, you have Render Counseling in Note, and there's a couple options here. There's a Render Full Counseling, which is the default for all the counseling plans. This will render full counseling statements in your visit note body for your view. So when you're viewing the visit note, after it's been completed, it will default all of these different counseling block paragraphs. If you choose the abridged counseling, instead of the full paragraph showing on the visit note, it'll state, please refer to the education handout for detailed counseling. This is only going to be on the view that you're looking at. However, it will render the full counseling paragraphs within your printout, or if the patient is looking at their education through their portal. So we're going to select Done. And now we see that our counseling has been selected, which means that we've documented counseling. We can scroll through all of the different lists of plans. So for example, let's say you took external photos, or maybe you did a refraction and we want to document for that refraction. We'll select that plan. So I don't see refraction here at the top, but we can scroll through the plans list that are listed all alphabetically and locate that refraction plan and select it. This is where you're going to generate the procedure code for the refraction, that 92015. Some of the plans will have CPT codes attached to them, and some of them will document treatment, and treatment will also contribute to billing. So here we're going to select our refraction type. Again, it will generate that 92015, so I'm going to select Done. And maybe we also did do over-the-counter regimen. We talked to the patient about over-the-counter meds, so we'll choose that OTC regimen for the blepharitis. And again, these are all of the statements. They're preloaded, but you can come in and customize those. And we'll say Done. Maybe we want this patient to follow up with us. We want them to come back and see us maybe in a few months or a few weeks. So each and every diagnosis code has a follow-up plan, and you want to use the follow-up plan within the diagnosis. So we'll select follow-up for next visit. Now before I do that, you also have the ability to look at eye history within any plan that you document in the ocular exam room. In the upper right-hand corner, you have a feature called Historical Data, and if I touch that, that's actually going to open us into the eye log or the eye history for this patient. Here we can look at their history, we can look at their procedure log, their test log, diagnosis history, and their follow-ups. And if I take my finger and swipe to the left, I can review the patient's clipboard. If I swipe to the left again, I can review any past visits. So all I have to do is select details here, and then I have a list of all of the different visits in a thumbnail view at the top, or I can use the arrow keys in the middle of the screen to scroll through those different visits. I can actually print information from here as well. When I close out of here and I close out of historical data, it brings me right back to the plan that I was working on. So here's my follow-up plan. At the top, I'm going to choose my follow-up time frame. Once I select the follow-up time frame for this specific diagnosis, it will remain sticky and remember my time frame. And I can document in my protocol what I'm having them follow up for, or I could go over here to exam, and maybe we're going to do a dilated fundus exam, or maybe we're going to do some diagnostics. We'll say Done. If we needed to document an additional diagnosis for the patient, we can just go right back to the diagnosis drawer, select our next diagnosis, and begin documenting. Let's review the quick impression edit. So I'm going to go here to the bottom and select quick impression edit. We're now viewing all of the information we've documented. We documented blepharitis for both eyes. Here are our findings that we documented. Here's the status of stable. We did a counseling plan. We documented a refraction. We did OTC regimen and also a follow-up for next visit. If we go now to the exam details, if you remember the first time we came in here, everything was defaulted to normal except for the CD ratios. But because I added in some findings with my blepharitis, look what that did. It overrode the normal statement and replaced it with the collarettes and also the abnormal tear breakup time. So by selecting findings and documenting where on the diagram, it'll backfill your exam details for you and take those normal statements out. Now we're going to say save the visit note. So now in our ocular exam tile, we're seeing that we did an exam. We are seeing the CD ratios that were documented. We have a number 10 for billing. We did do impressions and plans. It's showing we did one impression. We can actually scroll up and review all the details. So anything we document within any of these tiles, once we document that information, it's going to appear out here on our visit overview. Thank you for listening. We hope you found this tutorial useful. Please visit our support community to view additional tutorials.